Thank you, everyone. Welcome back. Please enjoy a special message from Governor Cox of Utah.
Hi, I'm Governor Cox. It's a privilege to be with you for this important conversation about family caregiving. Family caregivers are absolutely essential. Here in Utah, we have more than 400,000 family caregivers, and the need is growing quickly. Across the nation, 63 million Americans identify as caregivers, providing ongoing, complex care to older adults, people with disabilities, and those with serious illness. Caregivers are the foundation of care in our country. They are the backbone of our health and long-term care systems. They don't just help with daily tasks, they preserve dignity, offer emotional support, and provide continuity of care that improves health outcomes and quality of life. In Utah, more than 1 in 5 adults aged 35 to 54 serve as caregivers. Many of them are balancing work, parenting, and caregiving all at once. That's why here we aim to invest in our caregivers. We've implemented caregiver compensation, providing families more flexibility and support. And through Utah's Master Plan on Aging, we're expanding education, training, respite care, and other resources for caregivers all across the state. We're also grateful for the work of the Family Caregiving Collaborative at the University of Utah College of Nursing and their partnership with the National Alliance for Caregiving. Together, they are helping us recognize, honor, and strengthen Utah's family caregivers. The bottom line is this: recognizing, respecting, and resourcing caregivers is not only the right thing to do, it's a strategic imperative. Strong caregivers means strong families, strong communities, and a stronger future for Utah and our nation. Thank you.
Welcome our next panel and carries on the ballot wins. Moderating today's discussion is Allison Barkoff, Associate Professor and Director of the Hirsch Health Law and Program at the Medical School of Public Health at George Washington University.
Good afternoon, everybody. Okay, you can do a little better than that, especially after that amazing lunch. Good afternoon, everybody. I am really excited to be here and energized to be in a room with so many longtime friends and colleagues, as well as so many people who are new to this work. I was especially excited by a table filled with young students who are jumping into this. Again, my name is Allison Barkoff, and I am a longtime disability and aging advocate and a sibling caregiver. And I had the privilege of leading the Administration for Community Living. Yes, say it. At an incredible time when we worked together with all of you to develop the first ever national strategy to support family caregivers. And that is work that really drives, that is incredible work that continues to drive our national goals, as well as so much incredible work happening at the state level. So turning to today's session, I'm here in DC, and I think a lot of the conversation here, unfortunately, is now about how to focus on preventing rollbacks of progress. But this panel is the uplifting panel of the day. It is about the incredible opportunities and progress at the state level. Family caregiving is not only a deeply personal issue, and I suspect almost every single person in this room has some tie to caregiving, but it is a winning issue at the ballot box. And across the country, states are showing incredible leadership by passing policies that make a real difference in the lives of caregivers and their families and people receiving care. From paid leave programs to tax credits to expansions of home and community-based services, we are seeing victories that show that caregiving is bipartisan and it is truly a kitchen table issue. So to start this off, we are actually going to hear from Ben Vetty, who is the director of Washington Cares Fund by video, about some of the incredible work that's happening out in Washington State.
Hello, I'm Ben Vetty, Director of the WA Cares Fund, the nation's first universal public long-term care insurance program in Washington State. I regret that I was unable to attend this conference in person. Today I'm going to talk to you about the risks to which our families are exposed with regard to long-term care, how WA Cares addresses those risks, how WA Cares has survived politically when most experts thought we would not, and finally, I'd like to share some lessons from our experience that might be useful for those of you seeking to improve the care infrastructure in your own state or at the federal level. A program like WA Cares is needed because the way we've paid for care up to now isn't working. Even though 7 in 10 of us will need long-term care at some point in our lives, most of us can't afford it. And the reality is that paying for long-term care is a problem faced not just by low-income families. Even most middle-class families don't have enough retirement income and savings to live comfortably, much less to cover the high costs of long-term care. Even among those who do have some retirement savings, very few have enough to get by. In my state of Washington, 41% of workers near retirement have no pension and no retirement savings whatsoever. Another 42% have no pension and only enough 401k or IRA savings to replace less than 10% of their pre-retirement income. That means over 80% of us don't have enough savings to pay out of pocket for care as we age. Family caregivers have to step in to fill that gap, either with their own savings or by providing unpaid care. Almost half of family caregivers report a related financial setback, and they spend an average of 25% of their own income on care expenses. Many have to leave the workforce early to provide care. And caregivers 50 and older who do this lose an average of more than $300,000 in lifetime wages and retirement benefits. Washington State's Joint Legislative Executive Committee on Aging and Disability began a search in 2014 for a long-term care public policy innovation that would preserve and protect the Medicaid program budget, offer affordable long-term care insurance coverage for everyone, provide financial relief to middle-class families and their caregivers, and be financially viable and sustainable in the long run. After extensive research, the findings were clear. A program like WA Cares that covers everyone, similar to Social Security and Medicare, is the only way to provide affordable coverage for all. With that research and best practice in mind, in 2019, the legislature enacted the LTSS Trust Act, creating WA Cares. Since then, the program has been significantly improved, most notably by creating a near retiree benefit pathway and by making benefits portable for those who contribute and then leave our state to work or retire elsewhere. Workers began earning benefits in July of 2023 by contributing to the fund, and benefits go fully live next July. Workers contribute 0.58% of their earnings, about 0.5%, into the WA Cares Fund, and can access $36,500 in long-term care benefits when they need them. If they want more coverage, they'll be able to purchase private WA Cares supplemental policies in a structured market with strong consumer protections. Caregiving and long-term care resonate across the political spectrum, since nearly every family is affected. In 2024, a referendum was put on the Washington State ballot by a hedge fund investor. He spent nearly $7 million on a campaign to make our mandatory program voluntary, which would have made the program insolvent and led to repeal. Most experts were sure we would lose this ballot initiative because most political insiders and think tank experts were convinced that Americans are opposed to mandatory payroll taxes. While we, as a state program, were not permitted by law to do any outreach related to the ballot initiative itself, during the 3 years prior, we had conducted extensive public engagement, both through community forums and through TV, radio, and digital ads. We talked with Washingtonians about precisely the things that I've highlighted with you today: the challenge of paying for long-term care, the inability of families to afford this, and the harm to those who need care and to family caregivers. We highlighted equity issues for those who need care, for family caregivers, and for the care workforce. In addition to outreach work in the years prior to the ballot initiative, during 2024, a strong coalition of stakeholders supporting WA Cares, consisting of SEIU 775, AARP, the AAAs, and many other organizations, conducted extensive outreach on the ballot initiative itself. On election night, November 5th, 2024, when the results came in, 55% of Washingtonians rejected the ballot initiative that would have made our program voluntary and financially unsustainable, and thereby would have effectively repealed WACARES. What this clearly shows is that a majority of Washingtonians would rather pay a mandatory payroll tax to fund their future long-term care needs than be largely on their own when they or a loved one needs care. It's high time for the experts in Washington, D.C. to stop underestimating the American people when it comes to what they think is politically possible. And it's time for leaders at the state level to articulate a bold vision to support the people of their states. Finally, I'd like to share a few lessons we've learned in implementing WACARES. First, to win a campaign for a universal long-term care program and maintain the program against resistance throughout implementation, a broad coalition is critical to build and maintain momentum. In our state, Washingtonians for a Responsible Future was that coalition, and it consisted of organizations representing older adults, people with disabilities, family caregivers, care workers, and other long-term care providers. Second, proactive communication on the program's value proposition is essential to build trust with the public. Third, cultivating public support for a universal public program requires creating a we group to which we all belong rather than taxing the rich to pay for care for others. Maine learned this lesson when their universal home care initiative failed to win majority support in 2018. I went door to door to support that campaign, so I have personal experience talking with Maine residents about the issue. It failed in large part because it created an us versus them class struggle, rather than a social insurance dynamic of us all being in it together as part of a broader solidarity community. In U.S. political culture, we're not going to win on care if we approach it as a class issue or as part of a redistributive agenda. But we can win if we frame it as a nonpartisan human issue, a family issue. In my experience, if we surrender the humanity high ground by making it about economics rather than the universal right to human dignity, it's much harder to win. Thank you so much to the National Alliance for Caregiving for hosting this conference, and I wish everyone tremendous success in their efforts to improve our care infrastructure.
Okay, well, that is one incredible example of the innovation and boldness and what can happen when we all work together at the state level. I am so excited now to turn to our panelists. We have a great lineup today, really sharing a wide range of examples related to care, the innovations that can happen at the state level, and ways that we can together harness electoral momentum to expand caregiver protections nationwide. So before we dive into individual questions, I'm going to just go through and ask everyone to briefly introduce yourself, the perspective you bring to the conversation, and if you're representing a particular state. And we'll start with you, Nancy.
Thank you. I'm Nancy Lamond. I work at AARP, where I oversee our advocacy and education. And in this gathering, I'm representing 53 states, territories in the District of Columbia. AARP has worked for over a decade in what we consider an organized way, other people may not, to deliver both education and advocacy on family caregiving. And we've had the pleasure over those period of years to work with many of you in the room. Thank you. Thank you for being here. Thank you for everything you do every day. And thank you to the National Alliance for Caregiving for not only this convening, but for inviting me. I appreciate that very much. I started leading the caregiving initiative at AARP, I think around 2014 when we started it. And it was the same year my husband was diagnosed with ALS. And though I'd been a family caregiver before, I had this very unique professional experience of running one of the biggest advocacy efforts in the country at the time on caregiving and going home every night and dealing with a horrible progressive disease. He stayed in the home all the years before he passed away, and a hearty group of paid caregivers, and my sons and I took care of him. I say that because, you know, it's always said that if you're going to get sick in old age, make sure you've had daughters. It turns out sons are okay too. So I always felt that I had a somewhat unique perspective, which was important because we can go down a lot of rabbit holes in this activity. We can get over infatuated with technology. Technology is important. We can get over infatuated with providing more and more services. And we can also decide that we're going to try to put on the board a lot of legislative wins, sometimes just to run the numbers. And I'm really proud of the team. I don't think we did that. So over the last 10 years, we started with a piece of legislation called the CARE Act. A very simple concept. I think you all know it, which is family caregivers should be informed at the time of discharge on what their loved one needs. And we're able to enact that over the years in 42 states. We're then able to move importantly to what I considered the economic place, which I do think is the place where we need to put our attention for a host of reasons, not the least of which is political, and have worked in over 13 states on paid family leave. And then in a few states, 3, I think we've been able to do a caregiving tax credit. What has interested me is not the relative ease of making progress at the states, but the fertile ground in the states. You have to approach it differently. You're all from different places, but there's been in my view, much more fertile ground at the state level than the federal level. Federal level, as Allison knows better than anyone, we've had the Raise Family Caregiving Act. The real proof to me on that is what have those 500 recommendations or however many there are done to improve the day-to-day lives of caregivers. And that's really important. We have a paid leave bill that was passed by Senator Fisher, Senator King, that provides very modest tax credits to businesses. It's got to be implemented. We've got to learn from it. And we've also, I'm proud of the work we did in the last administration on an executive order, but the slog has been pretty tough at the federal level. And I hope if we do get to questions, somebody can raise their hand with a solution of what we need to do to move the agenda even more. But I'm grateful for the invitation, and I'm grateful for not only the passion, but the concrete results you all in the room are bringing.
Thanks, Nancy. And let's turn it to John now.
Thank you. And it's an honor to be here. And Allison, I appreciate your framing of this being the optimistic panel. I actually get to provide some somber numbers that will hopefully lift up what everyone else is going to be saying. I'm an associate professor at Virginia Commonwealth University in the Department of Health Administration. My research really focuses on long-term care and care delivery for complex patients, within which you cannot separate caregivers. And so as part of that, I had an opportunity to be the lead researcher for the America's Unseen Workforce, which was a research series sponsored by Otsuka Pharmaceutical. We conducted an economic valuation of family caregiving. And we found that at the time, 43 million caregivers in the United States were performing tasks valued at around $873 billion. To put that in context, at the time that we did the valuation, that represented 20% of national health expenditures. So if you think that we're trying to reduce cost in our healthcare system, and yet there's this whole other 20% that's not even being reimbursed. Now, for further context, because the numbers that we've been hearing throughout the day, around 63 million or so caregivers, we had a narrower definition. So we were looking at caregivers for adult care recipients. So if you think about the numbers that we came up with, and then apply that to 63 million, you're really talking about probably over $1 trillion that caregivers are providing. So I can provide some economic context. My other panelists really provide that critical kind of on the ground implementation context. And I'm really excited to hear from them.
Great, John.
Get to it.
And speaking of on the ground context, real world experience, I'm excited to kick it to Kelly.
Thank you. Thank you for having me. First of all, I feel also very honored and blessed to have this opportunity to speak up for caregivers. I'm Kelly Penny. I'm from Minnesota, where we have a self-direction program called CDCS. That stands for Consumer Directed Community Supports. We also, I have to brag just a little bit, are about to implement our PFML, so Paid Family Medical Leave Act in Minnesota. So we're doing great there. CDCS allows people that have been deemed eligible for a waiver due to their health conditions to self-direct their care. It gives people more choice, flexibility, and responsibility to choose the services and supports they need to remain living in their home. And it preserves their overall health and safety. I am a certified support planner in the state of Minnesota, so I work with over 250 care recipients, and I help them write plans to direct their care each year. It is my biggest passion, besides being a family caregiver for my daughter. I am a family caregiver for a 20-year-old daughter, Addie. She has a brain injury and abnormal brain development. She also has multiple chronic health conditions. She has undergone over 42 surgeries, and she is the strongest young woman I know. So I am a family caregiver first, but I am an advocate for all second. It's important for everybody to understand that I offer a perspective as an advocate for people that are disabled and elderly, but I'm also an advocate for caregivers. I want everybody to understand what it's like to be a family caregiver, to hold a full-time job, to still juggle all of the responsibilities of caregiving, and still get out there and advocate, because if we don't speak up, nothing will change. I'm passionate about helping others understand that self-direction programs are essential in caring for the elderly and/or disabled community. But I also strongly believe that protecting the integrity of these self-directed programs is crucial in sustaining the quality and long-lasting care that so many Americans need and will need in the future.
Thank you so much. And last but not least, Liz.
Hello, my name is Liz Richards. Thank you for having me here today. I am the founder and director of the Delaware Cares Coalition for Paid Family Medical Leave, which was formed in 2021 as a single issue coalition to pass paid family medical leave. We are also about to implement January 1, Delaware and Minnesota. And it occurred to me I'm starting to look like a walking ad for paid family medical leave. I'm approaching 7 months pregnant, due in January, and the timing couldn't be more perfect. I come to this as not only, the founder of that organization, but the reason I did that is because I was coming home to my home state of Delaware after spending 10 years on the campaign trail. I come to this as a campaign organizer, and I wanted to do something good for my community. What I didn't realize at the time, I had not had any children when I was organizing this coalition, which was intentionally broad, intentionally across the spectrum of Delaware organizations, but it truly revealed that this is a bipartisan issue because every person has a story. This is an issue, whether it's welcoming a new child or caring for a loved one in their final days. This is something where you give people the platform to talk about this, and they all have a story to tell, or will tell, or someone they know. And so I think it was really instructive. We were really proud to pass the bill with bipartisan support, which is not easily done. And I know other states are pioneering those efforts as well. But this issue is very dear to my heart, and we're very excited because it has become a big, exciting moment for Delawareans.
Great. Well, let's dig in. So I'll start with you, Nancy. With shifts in voter demographics, how can advocates make the case that caregiving is not a partisan issue, but a universal one that resonates with every single family?
I think we've actually gotten almost over that bridge. I do think that, first of all, I think awareness of family caregiving, thanks to work of everybody in this room and elsewhere, is very high. And not that we don't need to do more awareness, but I think we've kind of done a good part of that. The next challenge is getting more points on the board. That is, I believe, because of the awareness efforts and the way they've been done so effectively, that most legislators do understand that it is bipartisan or nonpartisan, at least in its general form. And you pretty much can't go in and meet with a legislator or a member of Congress without a personal story coming out of that conversation. And so I think we made a lot of headway on that. Look, one of every four adults is a family caregiver. We did polling in the last election. That may surprise you. We do polling a lot. In 2024, more than 70% of voters over the age of 50 in battleground states, the really important ones that none of us live in, say they'd be more likely to vote for a candidate who wants to support family caregivers. So we know that there's a base there that's pretty positive in our favor. The question is how do we move that to action? And whether it's at a state level or the federal level, it's the same challenge. It's always the combination of personal stories, data, compelling champions. They come in the oddest ways and forms. You all know that. But I think that is the challenge moving forward. And then as you move into the, let's say, the federal landscape right now, you have the added problem, other than federal government not being open, you have the added problem of the number of initiatives competing for increasingly scarce resources. I believe there's an opportunity. I haven't read all of the pundits on what happened yesterday in the election, but I do know the economy and healthcare were major issues everywhere. And I think this is the opportunity for all of us to talk about family caregiving, not only as a broad economic issue, but as a budget issue for families, and not just here and there, but a really concerted effort. We talk all the time, I think you know that, ARP, on prescription drug costs, hugely resonant. Caregiving is as well. In fact, polling we also did beginning of the Trump administration showed that a family caregiving tax credit was as popular, Republicans, Democrats, Independents, as popular as not taxing Social Security. And I can't tell you how popular not taxing Social Security is, particularly for our constituency. So I think there's a real opportunity. I believe the ground is very tough right now, especially, and not just at the federal level, as you pointed out, the state level, a lot of retrenchment in light of Medicaid cuts and others. But there is no question that as a nonpartisan or bipartisan issue, it is an opportunity that a lot of other agenda items don't have.
Thanks, Nancy. And I think you are so right about it being the kind of economic issue that people really relate to. And that's a perfect transition to John, who's going to be our data guy. Your research found that nearly half of all states are facing a caregiver crisis. I don't know what your measure was. I'd probably say every single state is facing a caregiver crisis, but that some states, and shout out to Iowa and Wisconsin, are actually doing better. Can you just share a few highlights of some notable state strategies that you found? And again, because we are a room, as Nancy just said, to take this from talk to action, how advocates can maybe use some of those findings to convince lawmakers to act.
Yeah, thank you for that the question. I think you're right. I mean, every state is probably in a crisis. It wouldn't take much to move a lot of those states. When you're doing kind of relative rankings, someone has to be first. But we're at a really important moment for caregiving, and you have to remember that caregiving really rests on a very frail healthcare system, and especially in rural geographies. So, as we've heard about, potential hospital closures in different areas, what's going to happen to those patients? Well, families are going to take on a lot of that work, and that valuation that we talked about before will just go up and up. So we found, nearly half, as you said, are at kind of a critical or high risk level, and so any slight movement will really push them over the edge. And in fact, there are only 5 states and the District of Columbia that were kind of really in that well-supported category. And 21 states were kind of in that safe for now. But again, any kind of slight movement would push them over the edge. I think if you're thinking about strategies, you could think of that in kind of like a matrix. So on the one side, you would have kind of the level of intervention. And that would be, federal, state, employer, and even individual level. And so there are strategies within each one. And then on the other side of the matrix, you would have directed, indirect. So there are direct policies that can really support caregivers, whether that be potential reimbursement, tax credits, those things that put money in someone's pocket. But there are also indirect ways to support them. And you have to remember that everything is connected. And so as you're thinking about policies and thinking about the fact that all of these things are connected, if you strengthen the direct care workforce, you are strengthening supports for family caregivers. If you strengthen kind of the local health system, you're strengthening supports for family caregivers. So anything you do that kind of helps in that arena as well will also help family caregivers. So, some of the strategies that have worked have been those tax credits, the payment and things like that. At the employer level, thinking about flexible leave policies, all of those can help. But I think as you're really thinking forward, remembering that everything is connected and you really can't disentangle kind of the frail healthcare system with family caregiving.
And I think that's actually a great segue to the conversation with Kelly, where we're talking about the Medicaid system and different ways that people can structure their supports in ways that both support the person receiving services as well as family caregivers. So as Kelly mentioned, she's our expert on the panel today on self-direction. And self-direction can really be a win-win for people who need support and for their families, allowing the person receiving care more choice and more control, while also allowing families to be paid for providing care. So the question for you is, how can self-direction work to ensure that people receiving care can live with greater dignity and autonomy and choice? And where do you see the biggest opportunities for states to lead the way in their self-direction programs?
So I think people who need care or are care recipients are able to preserve their dignity and autonomy by making their own choices through self-direction, having a choice in the services they want and need, and who will provide that service to them is imperative. For example, if a person needs assistance with showering, but they don't get to choose who showers them, one of two things are going to happen. They're either going to choose to not receive any assistance, and now we have health and safety concerns or injuries, or they're going to choose for somebody in their family to shower them, not receive any pay for it if there's no self-direction. And now we're pulling people out of the workforce to take care of their loved one, not receive any pay. And now we have problems with making their bills or other responsibilities. So that's one way that self-direction really helps, is it's allowing people to choose who is giving them the services that they need to stay living in their home. I think that's really important. The other really important piece of this is that self-direction inadvertently also increases people's independence, because when you give them choices, they are more driven to make their choices based on what they need, which brings them to a sense of independence, that they're not always relying on somebody else to tell them when they get to shower, how they get to shower. I think states can lead the way to self-direction by first ensuring their residents have access to affordable health insurance that allows self-direction as an option. I think that's first and foremost. Second, states can campaign to ensure that all residents are aware of how to apply for that assistance. I think we've heard that a lot today. You don't even know there's help out there because nobody ever talks about it. So ensuring that there is a campaign or some sort of marketing strategy to let people know the help that is available out there. And lastly, I think states need to incorporate a system to access these specialized services in a clear and simple manner with consistent rules and regulations. By doing these three things, states can preserve and potentially improve our care recipients' dignity, autonomy, and choice.
Thank you. So now we're going to turn to Liz. Delaware Cares was able to secure bipartisan support for paid family and medical leave. That is amazing. Really, yeah. Can we give a round of applause? I bet everyone in this
Team effort.
Yeah, I know. And we need you to teach us the lessons. So what are the lessons that for other states and advocates that we can take from Delaware's experience, particularly, and for anyone who knows me, this is like my life's mantra in building broad-based coalitions that again can overcome these partisan divides.
Yes. So when we formed our coalition, which was from the start a single issue coalition, we were not, focusing on a batch of issues. It was purely for one bill for paid family and medical leave. We were coming together to get one thing done, and that was it. We kind of like we're trying to get on the agenda with a big number of organizations joining us. So we honestly started the campaign with that in mind, because at the time, when then State Senator Sarah McBride introduced this idea and campaigned on it, it was like, oh yeah, okay, that'll happen in 10 years. And we said, no, we want to actually do this, and we want to put it on the agenda. So we talked to a number of different groups that we thought would be engaged. We talked to disability advocates were early in the game. AARP heavy hitters like them came on board as well. But we really ran the gambit, not only from the spectrum of caregivers to providers and healthcare and businesses, but also like the political spectrum. We had everyone from Working Families Party working to pass this bill to pro-life advocates in our coalition working to pass this bill. And when it really came to pushing it along, Delaware Cares, we kind of acted as the cheerleaders, reminding everyone that this is something we can all agree on. This is something that Democrats, independents, Republicans all support. I saw a poll recently from Virginia AARP that showed exactly what ours did, which was 83% of people in vote, I think it was voters, but people above the age of 18 in Virginia support paid family and medical leave. That includes 90% of liberals, 79% of conservatives. We saw that same data in Delaware. And even when you told people, yes, okay, so you support that, but there's going to be a little tax involved to pay for this, those numbers held up like it was a marginal dip. So people understand the policy. It's not that, we didn't have to hide the ball on anything. But our coalition really embraced the idea that if you are for this issue, you are at our table. We want you to be a part of this. And so we really were the cheerleaders for the campaign, while our legislative champions really did a lot of the hard negotiating. And that was with your, Chamber of Commerce and, insurance providers, and like, okay, how does this logistically happen? And I think that sometimes we sacrifice one for the other, where we're focusing all on the negotiation and the tough decisions and not enough on the excitement and the things that unify us, or vice versa. So we focused on doing both of those things the entire way through. And towards the end, Delaware, it's also, I want to acknowledge, Delaware is like, a three-party, all Democrats in the governor's office, House and Senate. There are other states out there, though, that are doing this right now that, don't have that luxury. So Pennsylvania right now not only has bipartisan support, but bipartisan sponsorship for their bill that they're pushing, and are inching closer and closer to the finish line. In Delaware, it's a choice to be a bipartisan bill. And now Congresswoman Sarah McBride, it was an intentional choice, because we thought that this bill would be more durable and present more of a pathway if we demonstrated that this is something that we can all get behind. And we saw both Republicans and Democrats, it was a good year for Republicans in 2024, but in Delaware, Democrats did very well. And a lot of those, Sarah went from the state Senate to Congress, another champion became the lieutenant governor. And a lot of the Republicans who voted for the bill, who were in really difficult seats for them, survived their reelections, pointing to bills like this, saying, look, this is just common sense. So I think that has really carried us through. That was our guiding star. And I think that us as advocates need to remember that we do judgment at the door, and if we want to change and get things done, we can do that if we work together.
I love that. I mean, we have seen that happening nationally too, with so many campaigns, whether it's Care Can't Wait or Act on Raise, that even in, my time in this space have gone from, this is really an aging table to this is an aging table and a disability table, and we're bringing in chronic disease and we're bringing in people providing care. And it's really the great coalitions from the state that I hope invigorate everyone in this room to keep thinking of a big, broad tent in this work. So we've talked a lot about kind of what we are doing, and I want to pivot now to talk about the road ahead, and then we'll open it up for questions. I know there's probably a lot of room for great conversation. So we'll go down, and I'm going to ask each of you the same question. As we look ahead, where do you see the most promising opportunities for new policies to strengthen support for family caregivers? And again, this is about motivating all of you. You're going to the Hill tomorrow, hopefully. How can people in this room help turn those opportunities into progress? And let me start with you, Nancy.
Well, especially going to the Hill tomorrow. I would say it's really important to tell the overall story of the tremendous amount of activity at the state level on family caregiving. I mean, we've been involved in hundreds of pieces of legislation. I'm sure there are hundreds more. That is not a story that is well known, probably outside rooms like this. And it's really important, I think, to tell that story. Second, as you meet with federal officials, I think it's also important to talk about what's happening in the state. I'm always surprised that a member of Congress doesn't really know that his or her state legislature might have moved on one issue or another. Never underestimate the importance of that, because of course state legislators are, probably you wouldn't get a member of Congress to admit this, but more in touch day to day with their constituents. I think, it's easy to say things like this. It's really hard to keep pushing and pushing in order to make that clear. The other thing I would say is that we can learn from all of you. There are broader coalitions at the federal level than there used to be. I wouldn't call them strange bedfellows. I think they're familiar bedfellows who are finally getting together on something, but not strange bedfellows. And the business community, some other kinds of interests, have not been as visible as you described a little bit in Delaware. And I think that's an opportunity, and we can learn a lot from states that do this and states talking about that. In terms of our targets of opportunity, we're focusing most of our legislative energy next year in the states on caregiving tax credits. We had success in Oklahoma, which surprises many people, also Nebraska, Tennessee, and Maryland last year. And we're gearing up this year in Massachusetts, Michigan, Hawaii, and West Virginia. And at the same time, trying to use the picture of progress at the state to propel a federal credit for caring that we hope we'll make progress on. We've come close a couple times in getting it in big legislation, but we want to use that as an opportunity to show what's happened in states and the movement in order to move to the federal level. So I'm very, very bullish on that, and hope that we can make some progress. I don't think we live in a world, others may disagree. I used to believe that what happened at the state level flowed up and informed the consciousness of federal policymaking. I'm not sure it's quite as potent as it used to be, and it's a function of there being so many issues and the current budget environment. So important to keep slugging away at the state level.
Thank you, Nancy. Let's turn it to John.
Yeah, so I think first and foremost, I think remember that healthcare is often a zip code level issue, and caregiving is a household / family level issue, right? So really understanding local caregiving needs within your state, and then follow that with comprehensive policies that address that. So what would those be? So some of them could be, really prioritizing benefit programs for family caregivers, thinking about potential reimbursement policies for caregivers. There are some states that have kind of played around with that, and really incorporating caregivers in the overall care process. So making sure that they're part at the table and part of the team. Strengthening the long-term care workforce. thinking about, better training, improving quality, strengthening supply. And then lastly, I think, expanding tax credit policies, and then also really doing a deep dive on a lot of these initiatives that are in play, the RAISE Act and so on, but also as it pertains to dementia, we have, I think we're in month 4, I think, of kind of the second wave of the guide model around dementia care. So, really taking kind of the wins from those programs and doubling down on that and being willing to kind of chip away at the things that are not working to make it easier for caregivers going forward.
Great. I love how you talk about the kind of connection between care, family caregivers, and the direct care workforce. I talk all the time about the three-legged stool, and they're just so interconnected. And I love that your research really highlights that. Okay, so turning it now to Kelly, motivate us. What should we be doing? How do we win in our state too?
I'm kind of going to piggyback off of what Nancy said, and I think that's keep talking. It's so important. I'm going to speak as a caregiver here, but I think the most promising opportunity to strengthen support for family caregivers is to keep talking about it. We as caregivers cannot be silent. Our elected officials need to understand what caregiver looks like. And even better, I'd love for them to feel what it feels like. It's not easy. Caregivers need to continue speaking the real truth about the hours we care for our loved ones, the exhaustion we feel every single day, the toll it takes on our mental and physical health, the financial status and how it impacts that. It impacts our family dynamics. It affects every single aspect of my life every single day. And if we don't let our elected officials know that, they don't understand the importance. And I think everybody in this room knows somebody that's a caregiver. And if you don't, then come talk to me and then you can. But I think it's really important we just keep talking about it. And it's not easy to talk about. As a family caregiver, the judgment that goes on is hurtful. It's not easy and it poses a lot of risks. It's a risk of being pitied or, yes, worse yet, being judged. It's a risk of being told you didn't do it right, you didn't plan accordingly. All of these things have been said to me by friends, by family, by passerbys. But I think we have to keep taking that risk and we have to keep talking about it. While speaking up is risky, I think it's important to remember that speaking up is crucial to creating change, and change is desperately needed because we are in a caregiving crisis. So keep talking.
Okay, and we'll turn it to you, Liz, to motivate us on your lessons.
Sure. I mean, I think Nancy brings up an interesting point and one that I've thought about a lot of, are we just going to be perpetually a nation where 14 states pass paid leave and the others don't, or what does that look like? But I think something that I learned in Delaware and learned through this entire experience with paid family and medical leave is that when you create a platform for people to join this issue, to become champions, they are born into the religion of paid family and medical leave and caregiving, because you cannot forget these stories. The women I talked to who, when I was doing early story collection things of, in 2021, a woman who was using her baby shower gift cards to pay her utility bills. And this was before the inflation spike. The woman I talked to who, wanted to get a full-time job, but had to keep working part-time jobs because she was a caregiver to her dying parent. To, the classmate that I knew of who was creating a GoFundMe because they were not going to get paid while they were out of work caring for their 2-year-old lymphoma, getting chemo treatments. Like, the more champions we can create at the state level, at the city level, as they rise and as they deliver policies, whatever it is, they will show not only that government can be effective and can work for people and can change your life and make it better, but they will not forget those stories. And so as they keep going on, they will continue to be champions on this issue. So I would just, again, encourage anyone from any walk of life who wants to be part of this for us to welcome them in, because we are here because we know how important it is and how life-changing it can be.
I love that. I love the idea of building champions of people who tell their stories. And many of us also talk about how do we build the champions to be the voice, whether it's governors or members of Congress. And I think many of us are struggling to transition the many, many leaders who have that personal experience, but to have them take that to be a champion. So I have a whole list of a bunch more questions, but I bet the people in this room have even better ones. So I would love to open it up. And Jason, I don't know if someone has a mic to pass around, or I should. Okay, awesome. Thank you.
Thank you very much. I'm Petty from New Jersey. I was tax paid by taking care of my mom for 7 years, but she left me at last March, 105 months. It is very well, sort of like the rewards are there because a family member is the one taking care. Now, always the issue is the dollar sign. Not now, but maybe in the future. Is there a way to have a single payer just to cap a little bit more of like, okay, this is qualified for single payer? Thank you.
A single payer in terms of long-term care insurance?
A family paid caregiver. I'm sorry, I may have to bump some of the major sponsors posted there, but yes, because AI is here, the data is already there. So is it possible in the future, not now, but in the future?
Yeah. Do people want to maybe jump in? So for people who didn't hear, the question was really about, I think this is about paying family caregivers, long-term services and supports. And what are some of the different ideas that are out there and potentially a universal program?
In the state of Minnesota, yes, it's possible. Through our waiver program, our Medicaid waiver programs, if an individual qualifies for a certain level of care, they can choose this consumer-directed community supports option where they choose who provides that care and they pay them an hourly rate to provide that care to them. And that allows for family caregivers to start being paid instead of only providing unpaid care. Does that answer your question? Yes.
Okay, I think we saw a question over here.
Hi, I'm Carla Vlastigi, and I'm a young caregiver to my mom who lives with young onset Parkinson's disease for about 16 years now. And so, when we think about infrastructure, we often think about physical things like bridges, transit, highways, and so caregiving is also critical infrastructure to our society. It sustains our families, it sustains our healthcare system, our communities, or our workforce. And so from your perspectives, what can we do to really bring awareness of caregiving as essential infrastructure in our society and not just a sole responsibility or just a family ownership? How can we change that?
So I'll just mention on the care infrastructure, a few years back when there was the big major bill that was being put together around infrastructure, I will say advocates for care were amazing in making that exact same argument. Unfortunately, when the bill got passed, not every piece of it made its way through. That was in the Build Back Better bill that was moving through reconciliation a few years back. But I'm interested in hearing other people on the panel. I thought the idea of care as infrastructure, the idea of care as the thing that helps you go to work, that helps you in these really concrete ways, was a really, really effective message. But I'm interested, for those of you who are kind of at the state level, how do you talk about it and message it? Because as you've even heard from the questions and from the people here, there's so many different ways to frame it as an economic issue, an infrastructure issue. It's about dignity and what resonates. Looks like Liz has some thoughts.
Well, I remember that very well because it was basically we had a break for the summer. We hadn't passed, we had introduced our bill, we hadn't passed it yet. And then over the break between, the first and the second half of the legislative session, Build Back Better, it was the summer of Build Back Better. We were in Delaware, the home state of Joe Biden, and, Chuck Schumer and Manchin had come to Delaware, at the train station being like, put paid family medical leave, it basically was like we were pushing for the national bill as the state advocates of, the president's home state. Didn't pass, and that kind of was the extra juice of okay, well, we got to do it. We're going to do it. I think that it's infrastructure, and I think that this comes down to politics too. I think frequently sorry about my mic. If we had done that piece of Build Back Better, would it be being rolled back in the same way that a lot of the environment, the green, tax credits are being rolled back? And I've got to leave no, because it's very hard to take these things away once they have been part of economic life. Yes, care is infrastructure. It's jobs. It is a job retention policy where if you want people to stay in the workplace, at the time we were seeing women exit the workforce by the millions because their kids were at home and somebody had to watch them. And, it was very, very clear in that moment. And I don't, I wish I had a great answer. I don't think I do, but I do think that, I think that there's a greater recognition, we talked about the elections last night, and others in this room have mentioned affordability. I think we are getting closer and closer to making that strong connection of, there's things that the government can do to address this issue. They're all hard, but this is actually one that's somewhat achievable. And while it seems complex, it's kind of straightforward. So I think that care is infrastructure. I don't have the perfect answer right now, but I do know that, when we did a hard shift on our messaging. It started, the pandemic is happening. If we want to make sure people can stay healthy, paid family and medical leave is the way to go. But once we were in that environment, we were like, if you want people to stay in their jobs, we need paid family and medical leave because they're leaving right now. So, no answers today, but yes, I think that we need to be connecting to what do people care about right now, and what is going to, be the thing that they vote on, frankly, to help leaders move.
And Nancy, you want to jump in?
Yeah. A very interesting question. I have to think more about it, but I have a couple quick thoughts. First, I'm a firm believer that you've got to kind of go to the place you think will move the debate right now. And I personally believe that place is healthcare costs and the cost to the family and the caregiver. Once you make your way through that, I'm a victim of a lot of experiences in this area. Once you make your way into that, I think there are opportunities to begin to frame it differently. And I think one of the most interesting future debates is, I believe the home is the new healthcare center in America. And if you look at what's happening with discharges from the hospital, et cetera, and if we can start to focus on home care, perhaps in a slightly different way, I think that may be a way to get to the infrastructure that you're referring to. Infrastructure was a word we heard during that period all the time. We don't hear it as much anymore. And so figuring out kind of how to get to that agenda in the current environment, I think, is the challenge.
Okay, I think we have chance for one quick. Nope, we don't. Okay. I was waiting for the wrap it up because I am so excited about what is next too when I see our next is here. So let me just close by saying first, thank you to our incredible panelists. This is all filled with advocates who have moved the care ball in so many ways. And as someone who has gone from 30 years of being an advocate to 30 seconds in academia, we are advodemics now. So thank you to everyone here. I hope it has given you some motivation, some strategies, both to keep pushing on the federal level, but to move the ball where we can. And for now, it may be at our states. But I am so excited for what is next because we do have some hope as we've been talking about champions. So join me in thanking everyone on this panel.